the little prompt. So good morning again. How is everyone doing? We doing all right? Yeah. So thank you for joining. My name is Natalie Vayu, and I'm part of the exchange team at Empath. And I have the honor of supporting these three lovely humans in a conversation about promoting economic mobility in early care systems. And we have a lot to talk about, and as conferences go, we have a limited time to do that. So the way it's going to flow is each person on this panel has a distinct voice and experience. To add to this conversation, they're going to do introductions and give a little context about that voice and experience that they bring, and then share some more about that, and then we're going to open it up to questions. That's an ambitious agenda, but we feel confident that we can include all of that. So I'm going to start by having Isis introduce herself.
Hello, everyone. Good morning. So happy to see you all here. My name is Isis Patterson. I am an Ascend student parent advisor, which means that I work with the Aspen Institute's Ascend student parent cohort to talk about expanding access, resources, and also elevating the voices of student parents. I'm also a full-time graduate student pursuing my master's at Harvard University in urban planning, and very happy to be here to share my experiences and some critical needs that will allow student parents and their children to thrive.
Thank you, Isis. Good morning, everyone. I'm Marjorie Sims. I'm Managing Director at Ascend at the Aspen Institute. We're based in Washington, D.C., part of the broader Aspen Institute, which is a global entity that brings people together to talk about critical societal issues. Our work is really focused on economic mobility for all families, and we have a national network of close to 480 organizations that are in communities working to make certain that families are supported holistically, and honored that Empath is one of our national network partners. So that's what we do. Thank you.
And I'm Marlo Nash. I'm the Managing Director of Children's Home Society of America, and we are a nationwide network of 21 state-based organizations who collaborate with children and families in our care and in our communities. Our members offer early Head Start, Healthy Families America, Parents as Teachers, as well as foster care, adoption, and mental and behavioral health services, and more. So from our perspective, from a long history of working in the deep end of systems where families have become involved in child welfare, for example, we're aware that we're very frequently connecting with children and adults at a very difficult and painful moment in their lives. But we acknowledge that within that, they carry with them the strengths, the relationships, and the meaningful stories that are part of who they are. So we believe it's important to respond to, engage with them, learn their needs, respond to their needs in a holistic way for the whole family. So in essence, we're a network that's really trying to put into practice a lot of what you heard from Dr. Shonkoff and Dr. Samuels this morning in a really different way than organizations like ours have done that in history. And part of that context is we understand that our organizations represent the private nonprofit component of a public-private ecosystem that seeks to help and heal children and families, but also has weaknesses that can cause harm and trauma, even when we're trying to heal harm and hurt and trauma. And we also know that every entity in that public-private ecosystem is doing our work in a history of classism and racism. So we really think about kind of 4 drivers in our work. And I'm sharing this much as a context to what I'll be sharing later on the panel. So we work to construct equitable policies, systems, and practices as part of everything that we do. We collaborate with families and individuals who've experienced the situations, systems, and services we seek together to improve. We create community and care for children and families who are experiencing adversities or who may be at risk of experiencing adversities. And we contribute to eliminating and mitigating adversities by applying prevention, trauma, and resilient sciences and neuroscience across a continuum that begins with primordial prevention or addressing the root causes and then builds to primary and secondary prevention of the stressors that can lead to child maltreatment. We're part of the panel today and part of the conference because we're in partnership with Empath right now to study the scale up of mobility mentoring. We have several of our members who are here in the room who are a part of a cohort. So Children's Home Society of Nebraska, Children's Home Society of Florida, Ascenda in New Jersey, and Children's Wisconsin and the Institute for Child and Family Wellbeing, and Children's Home and Aid in Illinois are all part of a cohort to look at scaling up mobility mentoring across different geographies within organizations that have multiple programmatic opportunities to spread mobility mentoring at the organization level. So that's a project that we're doing right now, which ties for us into a really central observation that we're working through and working on, which is that we know that economic factors are often what lead families to end up being involved in the child welfare system because poverty gets conflated with neglect. And so what are conditions that families live within that cause stressors that are often driven by poverty can look like or can be judged as, I should say, neglect, and that can lead to families being separated from their children. And the last thing that I'll say is that we think about that as a public health crisis because a third of our nation's children will end up having an investigation by Child Protective Services, and over 50% of our nation's Black children will end up in their childhood having an investigated by Child Protective Systems. So we are normalizing what is a crisis, and so we think it needs a public health approach. So that's what we bring to this conversation.
Thank you all so much. As you can tell, we have a wealth of experience and perspectives up here, and excited to dig into that a little deeper. We're going to start with Isis' voice, talking from the parent perspective. And Isis, you've talked about parents needing an ecosystem of support. And I think that's such an interesting framework and such an important one. Can you talk a little bit more about what that looks like for parents?
Absolutely. I think before getting into that, I want to recognize that there might be some information fatigue in the room. I know y'all have been sitting in the room for a while, maybe a couple of days. So I want to be able to, just premise this by saying, just hold in there a little longer. I think the conversation that we're about to have as it relates to student parents' access, housing, and childcare is one that touches many lives, whether someone is a student parent or is a parent of a student parent or somehow connected. We're telling a story of perhaps millions of student parents out there who are facing these struggles. So bear with us. But to talk a little bit about my story, I was a teen parent at the age of 15, and I ended up having a great opportunity to graduate from high school and to attend a college that would allow me to live on campus with my son. So I attended a 2-generational program that supported student parents on campus, allowed us to actually live in on-campus housing and to room with another student parent and their child. We were able to access the same facilities as non-student parents, so that means we were able to access the cafeteria, the library. Oftentimes you'll see kids running around the cafeteria, kind of intermingling with a lot of the traditional students. And so it was a great opportunity, and definitely one that is far and few. But I want to hone in on the fact that even while having a system of support in the sense that there is an institution that recognizes its student-parent population on campus, there were definitely still a lot of challenges. And quite frankly, challenges that the institution probably didn't think in advance of. For example, I came out of foster care, and so I was in a unique situation in which, during Christmas breaks or Thanksgiving breaks, I wasn't going, back home. I was staying on campus all year round. And to be able to have the cafeteria closed during those breaks oftentimes, and also just not having as much, connection to perhaps family. Those were things that, impacts a person, socially, emotionally during their time on campus. And it kind of creates an isolation, an additional layer of isolation as a student parent. So that was just one aspect. But the additional aspect was just struggles with childcare, struggles managing the fact that certain childcare closure dates would not align with when the school was closed, and trying to navigate that experience and also bring kids to classes and kind of normalize the fact that there is someone in class with like a 3-year-old or a 4-year-old was definitely challenging. But I would like to say that it also opened people's minds and hearts up as well to the fact that, there are people that have different circumstances even within their own school. I was very fortunate in that I got to graduate from college within 4 years, but there were certainly times where I thought that I was not going to be able to do that. And, the numbers show that student parents actually have difficulty graduating on time compared to non-traditional students. And a lot of that has to deal with issues like childcare. It has to deal with issues like being able to afford being in school. Just because someone is in school full time doesn't mean they get to stop paying their phone bill or their car note or things of that sort. And so student parents are often put in a position where they have to be able to decide, do I want to continue to go to school and invest in my future, or do I need to get back into the workforce to afford the needs that I have right now? And that was something that I was constantly facing, was, the juggling of the resources I needed to provide for myself and my son, and also trying to see, the light at the end of the tunnel about what this degree will do for me. But there were struggles in between, and at times I had to create, my own patchwork of an ecosystem, meaning I had to extend beyond the university, find resources in the city that university is housed in, find just people that were willing to also help step in when I needed childcare assistance, or if I missed that car payment. Can't be riding around to the grocery store if you didn't pay your last insurance. Now you're riding around with fear that your car can get towed, and then how will you get your kids to school? And it's this constant feeling of like, it's a constant fear. You don't know what's going to happen because you can't provide for your basic needs. And these are a lot of things that I think universities don't necessarily think about. And in their defense, they're trying to provide resources on campus, but student parents exist within a network of off campus as well. They have to be able to go school shopping and shopping for resources off campus. They have to engage with usually a public school off campus. And so I've seen a lot of those issues, and I'm realizing there are a lot more that institutions can actually do to support, those challenges that student parents face. And probably the biggest one that I had in mind was the fact that a lot of universities and colleges already have resources for their employees. Sometimes they have certain discounts, literally for car insurance or childcare discounts. And if institutions could think creatively about extending some of those benefits and resources to their student parent population, it really wouldn't create a new budget line. They would just be using their existing one. So I'll pause there. That was a lot.
Thank you so much. Those are some really interesting thoughts. Yeah. Marjorie.
Great, thank you. And so as we were thinking about the design of this panel and our conversation, we all felt pretty strongly that Isis go first, because her voice is the most important one on this panel. And it is reflective of our theory of change for strong policy and systems change. You start with the voices and recommendations of parents in these systems, right? One of our other parent advisors shared with us, who better to identify the cracks and gaps in these systems than the people that have fallen through them. And I know you all hold that, at the heart of your work, but we wanted to reflect that in the design of our conversation, right? So at Ascend, we always start our convenings with the voices of parents to ground the conversation in their realities as well as their recommendations. So someone's going to come up and help switch the slides, because I wanted to just ground you a little bit in the two-generation approach and how we talk about it at Ascend. So how many people know about a two-generation approach? Awesome. How many people are actively doing it in their organization or their community? Okay, so some of this will look really familiar to you, but I wanted to make certain that those that weren't aware of how we talk about it at the national level and what we're aiming for, you truly grasp that information. So two-generation approaches are truly about making, I want to skip these slides. Oh, I'm going backwards. Got it. Okay. So this graphic here we show a lot because it illustrates how our current systems and funding streams operate, right? On one side you have child-focused efforts, on the other side you have adult-focused efforts. That comes from the federal level to the state level to the community level. And this is how parents and families see these systems. An early care center somewhere and a workforce development center another place, or a community college. And this is about recognizing the entire family. We worked on this one sentence definition about two-generation approaches with the Frameworks Institute, because first and foremost, we want people to know where we're headed. Not what we're doing, but what the goal is. So we're aiming for family well-being by intentionally and simultaneously working with children and their parents or the adults in their lives at the same time. So that's together. Next slide. Okay, I guess I'll go without the slides because this isn't moving, but. So what I wanted to share with you next is a little bit more context about the two-generation approach and how it's unfolded. Thank you. Okay. It's a double clicker here. Okay. So a little bit about the history of the two-generation approach. A two-generation approach, or a whole family approach, actually is inherent in indigenous communities here and around the globe. Right? If a family has a crisis, community members don't just go to the family and say, we're going to help the child, or we're going to help the young people, or we're going to help the parents. They support the entire family. So recognizing that that is inherent, wisdom, it's intuitive, is really important as we think about this work. But for the U.S., in the early 1900s, when there were large waves of immigrant communities, being established, those families were supported holistically by settlement houses. That movement was really important. At the federal level, there's a lot of conversation that, the programs and policies really emerged out of the war on poverty. So Head Start is recognized as a real early two-generation approach, concept, because it was about providing early care and education to young people, as well as supporting the parents. Typically, it was a single mom, towards economic mobility for the entire family. But the important thing to know out of all of this is that this concept, the terminology was coined in the late 1980s by the Foundation for Child Development, because what they saw is across the country there were some early care programs that were cropping up that were adding what they called at the time a parent component, right? And those parent components were, efforts like maybe a 6 weeks financial education program, right? Financial education is really important, but not sufficient to move families towards economic mobility. So when they evaluated those 2-generation programs, what they found is the outcomes for the adults were very, very weak. And so they kind of, disbanded this notion of supporting families holistically because it was, too expensive and they didn't see the outcomes that they really needed. There is a lot of learning from that, and we're building on what we call 2-generation 2.0 in this, movement, because what we know is very important, and it was reflected in what Dr. Shonkoff and Dr. Samuel said, is that the way in which you work with families is very, very important, starting with their voices, their recommendations, not only through the design of programs, but through the implementation of the programs, as well as the assessment of programs. That's a high bar that we need to meet, but we're looking at systems and structures that have been embedded for, decades that need to be changed. So these learnings from, earlier iterations of 2-generation approaches is what we're building on. Here's just a slide of the theory of change that I just mentioned. You start first and foremost with the voices, recommendations of families. Then you use research and best and next practice. So thinking about, what they're doing at the Center for the Developing Child, or all the research that's happening across the country, is very important to build your work on. What we have found over the last 10 years is that leadership and political will are critical to changing these systems. Because what we know is most often people are really good at complying with government regulations, having outputs, but this is about the goals and opportunities for families, and you truly have to change the internal systems. And this is just some of the data that supports a 2-generation approach. Again, this is not, something that is being tested now. All of our work rests on very strong research. And for decades, Dr. James Heckman has been, studying early care programs that have very strong wraparound supports, and has demonstrated that there's a 13% return on those investments when you support the entire family. So 30 years of research, demonstrates the importance of a 2-generation approach. And then finally, I just want to, land on these principles, because they're the most important, starting point when you think about designing systems. When you look at these 5 principles, 4 of them are great for any program or policy. The one that distinguishes a 2-generation approach is the very first one. You have to be at that level of measuring and accounting for both children and their parents or their adult caregivers at the same time. That means the system is designed in a way that you can actually capture the outcomes for the family. Oftentimes when, we talk with organizations and, state systems across the country and ask them how many families they're serving, what they will say is that we serve, 500, kids in our Head Start programs, or maybe 1,000 students, on our community college campuses. But they're not talking about the family, right? This is about looking at the family, their goals, their opportunities, and, where you can better support them holistically. And so that's what we're aiming for, is more broadly, how do we change the structures and the systems, not how we change families. So I will stop there and let Marlo give a very specific example of how this unfolds in communities.
Thanks, Marjorie. And I just want to say, all those hands that went up when you asked if people have heard about 2Gen, I really think is a credit to Aspen Institute's many years of work. In the early 2000s, I was working in the nation's national network of statewide child advocacy organizations and multi-issue child advocacy organizations. There was a genuine debate about, are we advocating for children or parents?
Yes. Mm-hmm.
And so we've come such a long way, and I just appreciate the body of work. And I'm going to share, I'm really excited to share kind of a case example of how the Children's Home Society of America Network and a group of our members worked with Harvard Center for Developing Child, which is Dr. Jack Shonkoff's organization, to tell you kind of about a project that we did that was our precursor to the cohort I told you that we're in now with mobility mentoring. But I want to give you a couple things to listen for. First of all, I would ask you to hold Isis's story in mind. And what I heard, Isis, in your story is that there are some things that have been done to ease the role of being a student parent, but there are still challenges that you face and challenges that could be removed. And when we talk about engaging the voices of lived experience, it's really about genuinely listening to those kinds of things, making the changes and continuing to ask the question, okay, what are the challenges that are still being faced? So hold the story in mind, because this story is not about student parents, but it's about parents and really how we deeply listen to them. I can't read the other thing, I couldn't read my own writing for a second. The other thing I want to ask you I'm going to kind of hook you, hopefully, into, as Isis said, after your head is full with all the things that you've already heard today and everything yesterday, I'm going to hook you by saying there is a tool that is soon to be available to you online to use to help you do the kind of work I'm going to describe. And so the tool is Science by Design. It's developed by Harvard Center for Developing Child. And Susan Crowley is in the room at the conference, who knows much more deeply about that I do, but just know that everything I describe about the process that I'm going to tell you about embedding neuroscience in program design, you've got a way, you will soon, I think right after the first of the year, right, Susan, early in 2023, you'll have access to be able to kind of do some of this on your own with that tool. So I'm really excited to share with you. So our story started with a group of members in our network, our network broadly, wanting to become a network that is research to practice and vice versa. So I took a moment to introduce our network so you understand they're community-based, state-based, working directly with families as practitioners. But we are also very committed to all the principles and approaches that I shared in the introduction. And then the Harvard Center wanted to partner with practice leaders to apply the science of early childhood development to improve outcomes for large numbers of children and families. So our members, Children's and Families First in Delaware, Children's Home Society of Nebraska, who is here, if you want to talk to them more about this, Beach Acres Parenting Center in Cincinnati, Ohio, and the Institute for Child and Family Wellbeing out of Children's Wisconsin, who is also here. You can also talk more. And then the Family Partnership in Minnesota, and I'll kind of explain their role because they're not actually a member of our network, but they had a role in the project. So the project started in 2016 and ran through 2021, and I'm just giving that frame of reference as I go on and explain. And there were multiple components and multiple learnings from this project, but in the interest of time, I'm going to just kind of hit some high points. So one of the things, as I just referred to a minute ago, is the project used the framework of Science by Design. That framework you're going to have access to in just a few months. And basically, Science by Design has three components. First, you contextualize with science, you prototype and reflect, and you design with science and you prototype and reflect. So those are the components of the project. Contextualize, design with science, and then prototype and reflect. So in the contextualizing, what that means is, in this case, is talk with and listen to families, talk with and listen to frontline providers, and actually take what you've learned from them and bring it into the design of the project, and then keep talking to them to do that rapid cycle iteration that Dr. Shonkoff referenced this morning, and embed the science all along the way. So in this project, there were couple of windows into the contextualization involving the practitioners, the frontline staff. We're really saying we're using Healthy Families America, we're using parents as teachers, we're using Early Head Start and parent-child interaction therapy and evidence-based practice. But what we recognize is those aren't they're designed for specific purposes, and they're not the full picture of what we know our parents could benefit from, and we really want to think about additional ways that we could support the development and have a two-gen approach. And so in contextualizing with the families, there were interactions with the families, interviews, focus groups, surveys, and what kinds of things do they hear? So here are some of the quotes. The bills all come in at the same time. It's hard to manage them. I want to get back to school so we can have more income coming in. I struggle with finances. I want more stability. I want more family time. I'm not being able to self-care. So all those things, because of the work you do, can probably recognize that they are executive functioning skills, core adult skills. So in contextualizing with science and then thinking about designing with science, I'm skipping ahead. In contextualizing with science, it was to take all of those things and say, okay, what is like in a Venn diagram, what's a sweet spot of what we want to work on together? And so they heard families want to build their skills. They didn't necessarily say it that way, but that was the extrapolation from what they said. Programs said we want to build the capacity of our staff to develop more skills than just these evidence-based practices that we're implementing now are supporting us to do. So we want to do more because we see that the need and the interest is there. And then the science says build responsive relationships between adults and children, build responsive relationships between adults, so the parents and the practitioners, build adult stress management skills. So all of those things are what the science tells us works. So the project became about let's build adult executive function skills and let's do rapid cycle iteration to figure out how that's going and what we need to do differently as we go along the way to make it work. So they chose, there was a whole process to identify which models they were going to use, but they chose one that the Family Partnership in Minnesota had developed. So that was their role, and they were the model developers. So it was a partnership of researchers, model developers, families, and practitioners. And that became a really important group to bring together around this issue and do this rapid cycle iteration. So I want to tell you a little bit about one of the models that was chosen because I think it's really fascinating. So it's called executive function across the generations. And the interest is building what is an evidence-informed model now, building it to an evidence-based practice. And so just quickly, the key components are that children ages 3 to 5 and their caregivers learn to use internal state words. So because language elements are the first building blocks of executive function skills. So this literally learning the words to be able to communicate perceptions, thoughts, feelings, their internal states of being. So just some of the words are see, look, hear, smell, hungry, thirsty, sleepy, have fun, funny, proud, sad, need, have, to. So just what are the words you use to describe your internal state? The second part of the model features helping children and their caregivers create personal narratives about emotionally significant events. And the reasoning behind this is that if you are able to have a personal narrative of what's going on, it can help you work through the process of, okay, I'm at a point where I need to ask for help, or I need to either get some supports or use some skills I've built to prevent what might be a harmful situation. And it helps you sort of remember who helped you in a difficult situation, and so that you can internalize some of that help and carry that with you. So that's that personal narrative piece, is using your own ability to kind of construct a story to help yourself in any given moment. And then the curriculum is designed to build mindfulness skills among the children and caregivers, which everyone thought everyone would be skeptical about, and just sneak preview to the lessons learned, everyone loved the mindfulness piece. So that was one of the models that was used, and it embedded the 3 design principles that were based on science: build responsive relationships between adults and children, and build responsive relationships between adults. So the between adults and children's piece, they got just some of the practical parts of the model. They got a bundle of books, and the books were children's books, but they were all around internal state kinds of concepts. So they were reinforcing that, building in that internal state vocabulary as they were giving parents this opportunity and supporting them and interacting with their kids, which the parents reported. They loved the book bundles, and they loved the support to interact with their children around these topics that they were also being exposed to. Reduced sources of stress is a second element from the science. And one of the big learnings, I'll sneak preview that, one of the big learnings is you can't do interventions in people's lives that actually make them more stressed. So it's really important to think about how, as you're teaching them to have executive function skills that help them manage stress and manage life situations, you can't add stressors onto them. So reduce sources of stress, including how the program is operated. And then strengthen core life skills is another part of the science that was applied. So that's, in a nutshell, what we did. And here are some of the, real quick, I want to share some of the outcomes with you, and I got my stuff out of order here. But there were, even though the project wasn't necessarily set up to measure the outcomes on individuals, there were outcomes. There was reduced, now I'm going to do this from memory because I can't find the piece of paper that I had on. There was reduced incidence of child regulation issues, so it had an effect on the children. It had, sorry I can't find this in my notes, I apologize, but it had an effect on the parents too, a statistically significant effect on the parents. And then some of the other learnings were, so I share with you the timeline. Remember, they started in 2016, so all that prototyping and figuring out what they wanted to focus on, what was in that sweet spot in the Science by Design model. And all of that work and figuring out what programs, just all the logistics go into launching a program. All of that happened, and everything was getting ready to get started around March 2020. So the COVID pandemic, and then when George Floyd was murdered by law enforcement officers in Minneapolis, that also became a part of what became an environmental factors in the project. But I will say, all of us lived through that, so you all have many of your own COVID stories. So I'm just going to zero in on something that I think was a little bit of a surprise to folks, an observation. And that was when COVID hit, everyone had a shared experience. Everyone in this project, families and the practitioners and the researchers and the model developers, had to figure out how to have access to food, had to figure out how to have a strong enough Wi-Fi or have Wi-Fi at all, had to figure out, do they have the technology at home to do work from home, had to figure out how to navigate Zoom. And that made folks who are pretty, work in this field and are very sensitive to all that all the time, but kind of go to these kind of projects like, we're going to learn something by working with families, to kind of go, oh, we are collaborating with these families to get through COVID and to make this project work, so that we can, share with and learn from the families what we know, what we think we have to share and learn, and so that shifted a power dynamic, and the learning from that is you've got to shift that power dynamic. You've got to think differently about why you're coming to do the work. Even why are we, so a lot of times I think that we use this shorthand, engage the voices of lived experiences, and we stop at hearing their stories or adding a voice to an advisory council or a board of directors and sort of check the box. And what we're trying to learn as a network and through this project is one way is how do you deeply collaborate to make change, because everyone is going to benefit from that change being made. And to have that be what we mean by voice of lived experience. There's so many heartbreaking stories of young adults who spent time in the foster care system who come speak to a conference and then go not home because they leave the conference and they are homeless and hungry. And they'll tell you, I spoke to a room of 500 social workers, and then I left and I still didn't have what I needed. So we can't extract the stories and not be thinking about how do we deeply integrate that into making massive changes in a system that is based in a history of racism and classism.
Marlo, do you mind if I add to that?
Sure, go ahead.
And apply a lot of what you said so far. I really appreciate that science kind of toolkit and the framework, and you prefacing the need to bring the voices of those that are, that you're doing this all for, right? And not for the sake of saying we engage that group, but making sure to continue to keep them a part of that process consistently, because at the end of the day, if your lived experience is not the same as theirs, you may be coming up with policy proposals that you think are beneficial, but there may be this bias, or there may be this disconnect that you actually have. So engaging, your populations of focus is not just a matter of like formality or whatnot. It's something that you should actually be thinking very intentionally about, because they may see things or understand things that you don't. And that's every step of the way. As a housing person, I always relate back to housing in any component that I can. And when we are doing urban planning, we now understand, especially from the era of urban renewal, where governments and organizations would come in and destroy communities and build highways right through it. And we assessed that problem and we said, you know what, the whole issue there was the fact that there wasn't an actual engagement with the community. Or if there was an engagement, it was just a matter of formality. And they did things, they being developers, or even the government in some cases, did things the way they want because they thought that that was best for the community. And that's where they went wrong. Who knows what's best for the community than the community themselves, right? And so we should be thinking the exact same way about student parents, about families, again, whatever focus group you have, because they ultimately know what's best for themselves. Although they might not be able to accomplish it because their circumstances, those two shouldn't be, conflated with each other. Knowing what is good for yourself, but not having the opportunity to actually make that happen are two different things. So just because somebody's current circumstances are different from what they know that they want and need, help them to get what they want and need, or involve them in that planning process the whole way through. So I just wanted to mention that. And also, as it related to the scientific facts of child development that Marlo was talking about, that is huge. I mean, if we're talking about the ability, especially in critical years of a child's development, cognitive development, social development, those years, often parents can't afford to put their kids in school during those critical years of development. And during those years of critical development, parents are struggling with being able to figure out who can watch the kid, and the kid is not getting as much academic involvement or social exposure as they would in school. As a parent, when I was in foster care with my son at 15, he did not have access to early childhood education. And those presented actual problems later on with being able to catch up in a public school system that also has trouble with providing certain special education services. But my daughter, who is almost 2 now, has had access to early childhood education since she was 6 months. I'm not only speaking about the benefit that provided me and her father with being able to work and being able to excel in our careers, or even being able to pursue further education, but I'm talking about for her what that meant, to be able to have that social exposure, to be able to achieve certain milestones in school as well, that's also replicated at home. That keeps, that promotes so much childhood development that is incredible. And so when we talk about, delays that children have and whatnot, we again have to bring in why affordability is important, because it's not just establishing a market for childcare workers, which is huge. That's employment benefits and thus economic opportunity that childcare can provide, but childcare also provides parents an opportunity to further their education and thus be a workforce for, industries, which is huge, another, economic benefit of childcare, and then of course the child. So if we're talking about childcare affordability, it's not just for the sake of a child itself, it's for the sake of an economy, a future of workers. It's a full circle thing. And like Marlo said, we've seen issues with this during the pandemic. Parents at home. Now, of course, with a lot of things, especially public health problems, it exacerbates already existing discrepancies in our society. And we've seen that dramatically. But what we also seen is that we had a workforce that was required to show up as essential workers, and a workforce that was able to work from home via Zoom. Now we can all laugh about the issues with Zooming for your kids and Zooming for work, but the fact that there were certain populations of people that got to work from home and have their children at home with them, but then there was another population of people that were required to show up for work. When we had no vaccine yet, people were literally required to show up for work, dying to keep this economy alive. But that wasn't enough of what they were going through. The other issue they were going through is that there was no priority during that early point in time where they had access to childcare. Everything was closed. So what we don't also hear about is, what are the stories like of folks that had to show up to work, childcare facilities were closed, they didn't have access to childcare facilities. What were they doing? What were their kids doing? What about the stories of folks whose kids actually had to not go to school at all? Like just kids not enrolled in Zoom or anything of that sort. These are stories that we also have to remember. We have to seek them out because there are problems there. So I think Marlo pointed to the science, and I think the work that she's doing with the Child Care Center as well at Harvard University is extremely, extremely important because it actually shows what are the actual effects on our child's development. Because these are literally leaders of the future. They're going to be future pilots. They're going to be future policymakers. These are folks that we, individuals that are children right now that are going to grow into adults. And so making sure that they have that early academic exposure, social exposure is going to benefit society as a whole. And it's an investment that we should make in our future because our future lives depend on it.
If you don't mind, I'm going to layer on to this research around brain science. I think that it's, fully well established that, babies' brains, develop at a really rapid, pace early in life. And also the next period of life when your brain is rapidly changing and developing is during adolescence. We have an Aspen Fellow, Dr. Sarah Watamura, who is at the University of Denver, who said, so I'm wondering if there's a two-generation aspect to this brain science. And what her research and other researchers have determined is that when you are caregiving for a child, your brain is actually developing and rewiring itself very uniquely to center onto that child. So making certain that we're looking at the whole family when we're thinking about, research and evidence, that this notion of parenting, and it, she started her research, with moms, but then, learned that this actually is the parenting aspect that is rewiring people's brains. So it could be a dad, it could be, whoever's the primary caregiver for that child, your brain is actually being reformatted to care and zero in on that child. So what are the policies and programs needed to support that parenting role at that critical time of brain development for adults?
Did you want to add anything, Marlo?
What's on my mind that I'll share that's definitely related, but and I've been just trying to say this everywhere I go, so I'm going to say it here. I'm going to tie it to Dr. Samuel's encouraging not only everyone in the room to vote, but I'm going to take that a step further and really encourage you to think between now and Election Day, what can you do to help all of the parents who are in your care and in your communities get out to vote, because they are, because of the nature of work that you do, they are in large part families who've been marginalized by voting restrictions. And I'm going to draw just a couple of things. So one thing is that there's a large body of evidence now, and you all, because of the work that you do with young children, have probably already seen this, but infants and toddlers born during the pandemic are showing up much, much lower than their like cohorts from years prior to the pandemic on verbal, cognitive, motor skills. And now they're showing up in for Head Start as 3-year-olds and things like that. And it's very clear to the teachers that it's an issue. So this election has a huge bearing on what happens about that, because of all the things that Dr. Samuels talked about. Because when those kids really start coming into the K through 12 system, we're basically going to need the inverse of what we have now, which is more special education than typical education. And our systems are going to need help to move that quickly, if they even can. So that's what I would add, is a very major concern around the children, and then their parents, because the parents are going to be faced with, sort of all of that. They need support to help the kids catch up.
Thank you. So we have a few questions, but I think I'm going to turn it over to see if there are any questions from the audience, because I am assuming that there are. And so who would like to ask one? Oh, okay, I see. Yep, ask one of our panelists. So you can direct it towards all three. In the interest of time, if you could just keep it brief, that would be wonderful. I know. Thank you, though.
My question is for Isis. I'm a coach in a 2-generational program, and I am just curious what you found as the most beneficial or essential aspects of 2-generational programming that helped you.
Yeah, thank you for asking that. I think that the number one benefit of the program as it was and what it provided was the opportunity to live on campus. Certainly there were drawbacks, but I think now being a commuter student in a graduate program, there are difficulties in living further away from campus. So to live on campus, have access to the library, have closer access to the classroom, I think is really, really unique and important. As just one recommendation for a longer term solution, it's more follow-up or wraparound services after student parents graduate. I think 68% of student parents battle with housing insecurity and 53% with food insecurity. And so that can be happening on campus, but it certainly also happens once student parents move off campus. And we all know you can't eat a degree and you can't pay rent with a degree alone. So making sure that there are follow-up services, specifically housing services, is something that I would recommend for 2-generational programs.
Thank you. We have time for one or two more questions. So don't be shy. Oh, hi.
Again, my question is also for Isis. Parent voice is important, but we often struggle with hearing everybody. People who are vocal are the ones who are constantly represented, right? And you're pretty resourceful, and not everybody is like that. So how do you really get to people who are not being heard and who are the ones we really want to listen to as well?
Yeah, I think that's a question that we need to be asking ourselves that every day, certainly. I think for one, it's making space and also recognizing those voices qualitatively and quantitatively. A lot of the problem with recognizing student parents specifically, I'm talking from a student parents lens right now, but maybe this plays into other aspects as well, is that there are concerns with gathering data, especially from colleges aspect. With my college, it was very unique because the student parents kind of sought them out specifically because they had an on-campus program, but there are student parents all over it, including this campus right here that we're on. And a lot of the colleges don't recognize the population or can't because of privacy concerns. FAFSA has a question on it as to whether or not you have dependents, and so they can find them out that way, but colleges also don't want to kind of impede people's privacy by seeking them out. And I think being able to have the college actually think more creatively, or even its student parents that are already vocal about being student parents, speak out in a way that's supportive to say, like, come to these gatherings, or we want to hear your story. It's really about placemaking and space making, making sure that people would feel comfortable in that space, not in a position where, you know, they feel like they may be targeted instead. So I think that's the number one space. And it is using the people that are vocal, the people that are resourceful. Those are the ones that should be helping to open up the space and then allowing those voices to come to those spaces themselves. That would be my recommendation. But again, this is an ongoing problem, certainly.
We have time for one more question. I got permission to do 2 or 3 more minutes. Do we have one last question from the audience? You're all doing great. I think they listen to you, Isis. People are hanging in. Thank you. I see a lot of head nodding and smiling.
Natalie, if there's not a question, I have a quick tool that I would love to
Sure.
share.
Do we have any?
I need to.
Okay, go right ahead, Marlo.
I want to share. I was here yesterday and listening, and I think a lot of times what happens when you're trying to do this work is, and it came up yesterday, the culture in your organization, or the culture in the system. And I just wanted to share, could you go back one? I wanted to share a tool that, there you go, that's all right, that can help you make culture visible and then help you create a vision for the culture that you want, and you can do it within your organization, within a program probably, but more like on the organization or even the systems level, like public, even engaging with the public system. But the process, just very quickly, the process is you conduct surveys of your stakeholders, so that can be whoever you define, and I'm having to really go fast, so I can't tell you all the details, but there's a survey process, and it basically helps you identify what you see on the one that's got red on it. Let's see, on your left, is the surveys that were shown that said, here are some negative things that we see in our culture. And then the other image where there's all blue, mostly blue, it was a survey that says, well, what are the kinds of things you want in your organizational or your systems culture? And so we want these positive things, right? So could you go, do I have to do it now? I'm trying to go fast, I can't. There we go. So in this particular coalition that I worked with to do this, they got that information, and that was their information you saw on that previous slide. And then they said, what are we learning about our current culture from this information? So then they contextualized what they were learning about their current culture and put some names to it. Like, what are some of the things that we see? I can't even read that, so I can't. Like a fixed mindset. So in this case, this was a public-private group of system leaders, and they were saying, if there's a problem, we just go right in and try to do the fastest thing to fix it, instead of a progress mindset where we listen to science and we listen to families and we really think about what's going to be the change that's going to make the most difference. And I don't have time to go through each example, but the process was, we want to move from this defensive kind of these negative components of our culture that aren't getting us where we want to go, move to this constructive. And so this, on the other side, the constructive is their vision for their culture. And then they went about the practice of starting to have accountability to creating this vision collectively together. It's been so powerful that I just wanted to share it with you. And I'm happy to talk with you more about it. It's a relatively inexpensive process to go through, and it can be a game changer if you're struggling with culture and wrapping the right kind of culture around everything that we've talked about.
Thank you so much for sharing that. So mindful of time, I believe Nikki's going to come back up and let us know what she's doing next. And while she's making her way to the stage, I would love to encourage all of us to give a round of applause for yourselves for hanging in there, and for our wonderful panel for sharing so much good information.
Yeah.
It's always a
If we
long
could have
walk back up.
traveling music for you.
Walk away. So we're going to be in here for lunch, everybody. You can see the lunches are over there. We are going to do our lunch and learns during this lunch, and I believe it's this side of the room. We're going to put those papers on the tables, and so you can look out for, on this side of the room, where your lunch and learn session will be. And we'll get that all set up in just a minute, so feel free to go take a bio break, stretch your legs a bit, and then come on back for lunch. Thanks, everybody. And thank you again to our panel.